Yeah, you see that? We can see that.
Yes, I can see.
It changed.
Yeah.
Perfect. Okay, so we can look at OCD today, because it's something that we as Rabbanim meet very, very often in our Rabbanis in many, many areas, many places, including a Tarta Mishpacha, which we're going to speak about. There's actually a very nice chover just came out by Nishmat, which I will send to the group. I haven't read the whole thing, but it seems to be a very good and thorough presentation of the questions of OCD and Tarta Mishpacha. So what is OCD? So it's an anxiety and or disorder which we could explain connected to apprehension, to concern of something that's going to happen, fear, worry, repetitive behavior, and its compulsions. That's basically the sikum of what OCD is, as the this little cartoon here says. You see the program on OCD last night. See it? I taped it and watched it 367 times. So it's repetitive behavior that we just do again and again and again. So if we look at the Wikipedia definitions, and we'll look at some of the pages there. Obsessive compulsive disorder is a mental disorder in which a person feels the need to perform certain routines repeatedly. So we have to do them again. We call them compulsions. They're compulsed to do it, or have certain thoughts repeatedly. So we have obsession. So it's compulsive disorder is to do something again, and to think about something is to be obsessive about it. I obsess about something. That's a thought. So to do something again. We all do that. Isn't that what the shachar is? Putting on tefillin, we do the same thing again and again. Every day we do the same thing, and every day we make a bracha. Every time we come out of the bathroom, we share a tzar. So we need to think about that, because generally religion, and not only Judaism, but any religion that has a ritual basis to it, which is basically every religion, is going to have a component of things that we do again and again. And how do we distinguish between normative religious behavior and OCD? That's a whole discussion in psychology, but how do we do it for our needs? Obsessions are thoughts that occur and persist despite the efforts to ignore or confront them. So I think about things the whole time, and maybe I don't do the same action. Maybe a person's living their life perfectly normally, but they're thinking the whole time about certain things. And even though I try to ignore it or I try to confront that, I have no control over it. And what's the common denominator of all OCD is the lack of control. I can't control this thought. That's why it's a mental disorder. I'm not able to control that thought. And some people with OCD, so they're compulsive. They perform compulsive rituals because they explicitly feel that they have to. So they have to do it again and again and again. While others act compulsively so as to mitigate the anxiety that stems from obsessive thoughts. I have to do this thing again and again because I have the fear that my car is going to be unlocked. So I go back and lock it again and again because I'm afraid that I didn't lock it. So that's one type of compulsive disorder. And one side is I just do it again and again. I wash my hands again and again and again. They're not because they're dirty. That's what I do. I just wash my hands again and again and again. So examples we just had, and it's a little bit of the examples we just gave. So obsessive washing, excessive cleaning. Remember that we have a whole holiday which is around cleaning. So cleaning for Pesach becomes completely impossible if you have OCD. Hoarding. So I have things. We have a guy in our building who subsequently left the building and left his whole garage full of garbage still downstairs. It's going to take years to get rid of it. It just hoards things. Just has it again and again and again. Why? That's it. And of course, sexual thoughts, immoral thoughts, the thoughts of things that I don't want to think about. Not to do. I think about them. So, this person said, I started a group meeting in my house with people with OCD, not because they have to have it, but surely one of them will bother enough to clean the house. So people, they clean again. I'm sure that everybody, if you think of your kehillah, I can think of my kehillah, you'll have in your kehillah people who have that. I can think of a woman who has obsessively cleaning the house. I can think of people who lock the door obsessively, who wash their hands obsessively, who we know that, right? So this idea, you have to wash it. And the idea again is either because I have this fear that it's dirty, or I'm just obsessed to wash it again and again. I like washing it. And then it's this, what have I done it? And the problem with OCD is that the more I do an action, the less I'm convinced that it's actually I've solved the problem. So all of us, we have, we can imagine, did we lock our door when we left and came to the office this morning? Or is our car now locked? And maybe we'll think, oh, maybe it isn't. So we'll go back and lock it again, and that's it, and we're done. If OCD, you'll go back and lock it again. When you go back and lock it again, you're less convinced that it's now locked, than you were before, because maybe just do it again. So again, this repetitive behavior is something I have no control over because I have a fear that I didn't do it properly. So what are the common obsessions? So about 40% of people with OCD have obsession with dirt, with germs. Remember that, you know, if we're living in this era of COVID, that in which dirt and germs everywhere, and we're told it's the worst thing. So, and you're obsessive. Oh my gosh, that's terrible. 25% are obsessed with fear, with fire, with death, with illness. You know, with some nezek, with some terrible thing happening. 70% are obsessed with symmetry. Things have to be ordered. Things have to be, you know, arranged as it should be. 4% of just aggressive thoughts, unpleasant thoughts, things I don't like, I want to think about. But 13% of all obsession, 13% is religious obsession. Not all of them are Yidden, not all of them are from Yidden, not all of them are keeping Tartar Mishpacha. But we have to understand that that is something that's incredibly common. 13 is almost, you know, 1 in 8, 1 in 7 people who have OCD. Not 1 in 8 people have religious obsession, but 1 in 8 of people who have obsession, who have OCD, which is not that uncommon, we'll see in a moment, in the community, have that around religious things. And so we think of what a nervous ritual. So we have repetitive. Now, when I repeat something, I seek relief. But in fact, if I have OCD, that actually makes it worse. But not all repetition is OCD. Think of all the rituals that we do have in our lives. We have bedtime rituals. We read our children a story. We take a shower, brush our teeth, say Kriyat Shema L'Mitah. Those are rituals that we have. That we check our email, we turn our phone off. We have religious rituals. I just said we daven every day the same thing. That's a ritual. So not every repetition is OCD. And in fact, and he said in the Choveret and Neshma, it makes a distinction. I think that one of the distinctions is that when I repeat those rituals, they are calming for me. They strengthen my belief. They are a source of comfort for me. If I have OCD, they are exact opposite. They don't strengthen any belief, and they become not a source of comfort, they become a source of distress. And that's possibly a difference. The other difference is I have control. We have a Bechira Chofashit, in that I can not brush my teeth before going to sleep. I could not say Kriyat Shema L'Mitah. I could not put on tefillin every day. I have that choice. If I'm OCD, I do not have that choice. It is a mental disorder that I do not have control over. And one of the most important things that we have in our lives is control over our lives. That's we have Bechira Chofashit. If you have someone who has OCD, and you have to understand in your community there are people like that. If you say someone has OCD, you have control, and you have Bechira Chofashit. They don't. They really do not. They don't feel they are in control of their life, and they know that they're doing things that are problematic. So the people rely on these compulsions and escape from their obsessive thoughts. I have an obsessive thoughts which cause me to do things, where therefore my compulsive actions come to give me an escape from this thoughts that are pushing me. It's not this dibuk or devil got into my head, but it's just this I obsess with cleanliness. And so my compulsive action of cleaning is overcoming that thought that maybe I still have left germs. And if we translate, of course, into religious area, so we can imagine if I have a concern that I'm not tohora, so if I do more bidikot, I'll be more tohora, or that the bidikot I did were not good enough, and therefore more bidikot I do will be better. That's the idea. But as we said, the person is unable to control that idea, not the thoughts. I can't control my thoughts. Remember that we believe that you can control your thoughts. We have this idea, lotatoru. We have this idea that you can think about other things. We don't have obsessive. We don't think the whole time about certain things. But this person cannot control neither their thoughts nor their actions. I have to do that activity again and again. I'm drawn to do it. I can't not do it. So I can't not wash my hands. I can't not do obsessive bidikot. I can't do that even for any sort of time. Even maybe there's a short amount of time I'm able to not think about that, but I know it's going to come back in. So even when I'm not doing it, I'm not doing that activity or not having that thought, I know that it's going to come back. I know that I'm going to have that thought again. I know that I'm going to have to do that activity again. And so it's a vicious cycle in which there's really no way out. And it's a terrible thing for a person to be in. So as we just said, it's this obsession, which lead, what if and then and what will happen. A woman called me just now. Give you an example now. A woman called me. She is at the moment, she just had a baby through cesarean, so she needs to use contraception. But what if I see bleeding? What will happen? What is? And then she says to me, when I only have 4 girls and I want to have a boy, so what would you suggest to have a selection to have a boy? So I said, well, in the meantime, that's a relevant question because the next 2 years you're going to be using conception. So we don't need to worry about it now. No, tell me what I should do. I said, well, what I'm going to tell you now may not be irrelevant in 2 years' time. No, you have to tell me now. So this obsession of what will happen, how, to try to get my life in order. But of course, the more that I have that obsession, the less I'm in control of my life. So that leads to, and that can be due to external things, such as I saw something, or internal thoughts. I fear a thing. So let's imagine, we're going to translate this into Tarta Mishpacha. I saw something that is red. So now I have this obsession that I'm Tameya. And the internal thought is well, if it, it must be that's Tameya. And even if I don't see it, there must be, I feel that a hargasha, there must be that I have bleeding. And that leads to anxiety. So the obsession we can translate is what did happen? Anxiety is, oh no, this thing is happening. So my anxiety leads to the idea of fear that this thing is true. I thought it was red. I'm seeing red. It's right. It's now blood. I'm now Tume'ah. So there's an anxiety of being Tume'ah. And remember, being Tume'ah in the area of Tarta Mishpacha is, of course, affects my husband. I machshil my husband with sukaret. So that's terrible fear, which leads to compulsion. What the compulsion will be? I do a lot of bidikot. So I'll do tremendous number of bidikot. If it's washing, I fear the germs. I feel that that I'll get sick. I'll fear that I'll be unclean. So my obsession will lead to anxiety of fear. Then I'll have compulsive washing, and that should lead to relief, but it doesn't, because the momentary relief that I have, in fact, makes me more and more concerned and more obsessed and more anxious. And so again, if we talk about Tarta Mishpacha, the obsession is I'm Tume'ah. The anxiety is everything I'm going to do is be problematic. I'm machshil myself and my husband. Compulsion is to do more bidikot, which of course is not a desirable action to do, and that leads to very, very temporary relief. But really, it doesn't. And really, even though the Rav told me it's okay, or even though I know it's white, but it's not really, because maybe I saw something that was problematic. Maybe I didn't look at it properly. Maybe the rabbi didn't look at it properly enough. So we've all had those we should have, if we deal with Tartar Shecha, we will all have those women who will call up and say, that she sent you a completely white badika and it's completely fine. And you say, fine. And the woman will argue with you. No, it's not. It's, Rabbi, look at it again. There's some red in it. I know there's red. I saw red on it. My husband saw red. It must be. And so that cycle is impossible to break. Or, well, hopefully it's not impossible to break, but that's the problem. And these things occur to such a degree that it's going to adversely affect you, and it's going to take hours of a person's time. The person's going to spend a tremendous amount of time worrying about that thing. And most people understand that this doesn't make sense, but there's just no way to break it. It's a mental illness. I can't just say, well, just overcome it. I can't. I'm incapable of doing that. I have this obsession. I cannot not do that thing. So listen, we spoke about how common is it. So, if we look at the 2.3% of lifetime prevalence of OCD, so and about 1.2% of US adults have OCD. So if we have, let's say we'll take a conservative estimate, you have 100 members in your shul. One of those people, on average, has OCD. Now, if they're Jews, Reform Jews, it may be well more than that. That's an average, maybe well more. 35% of adults with OCD have, moderate impairment, but 14% have mild impairment. Some people are going to have very serious impairment. Some people are going to really have very, very big problems. So about 50% have significant could mean that woman who's coming back and doing bidikot again. So we took the numbers. We have 200 people in our community. 2 of them have OCD. One of them has it severe OCD. One of them has, they can pretty much get over it. And there's questions related to, my sexuality, my place in society. It's common among particular age groups. It's common among 18 to 29-year-olds, but you can have it in older people and in younger people. And it's higher in women than in men. But there are men who have OCD, and we can look in the case studies that we're going to discuss in a few moments. We'll see that there are, how it impacts men as well. We all think that, oh yeah, women have a problem with bidikot, men are fine. That's far from being the case. What causes OCD? We don't know. The answer is, but there are various suggestions made. Could be a high IQ. People are very, very smart, so they're overly concerned. As Shlomo Melech told us that Mosif dat, Mosif machov, right? The more you know, the more you're worried. This possibly is a
chacham yoter.
What?
Altis chacham yoter.
So maybe there's possible genetic mutation, possibly the genetic. You see it in families, although it's hard to say that it's genetic because it could be a familial thing. We just that you're in a family which are obsessive, you like to be obsessive. There's certainly neurological differences, maybe to do with how it is in the end. Somebody didn't close their mic and we can hear them. There's possible suggestions like, there's infections in childhood, those sort of things. What's incredibly important, we're going to speak about this again and again later on in this. We're going to speak again and again because we're going to get obsessive about it, is that it has to be diagnosed by a mental health professional. There are members of this group who are mental health professionals. That's great. Zenifla. I'm not. So I cannot diagnose that. And I cannot treat that. And that's very important when we think about what do we do with that. But it's very important to remember it's a mental disease. It's not nudnik. It's not just nerves. It is a mental disease that a person has no control over. And it's very important when you're dealing, remember, when I'm dealing with the OCD patient, I'm dealing with them and their spouse. I'm dealing with them often and their families, because their families are being driven crazy as well by them as well, by the cleaning for Pesach, Shigon, or by the getting ready for Shabbat, or by the Tfilah, or by Tarta Mishpacha. Tarta Mishpacha doesn't affect maybe all the children, but it does affect the husband or the wife, whoever's the frantic party in this. So you have to understand, we have to be very conscious of the fact that this is a mental disease, that it should be treated as such, to be treated as an illness. And therefore, we have to understand it's not that person's fault. It's not that they're doing it to drive you crazy. It's not doing it because this is the way of getting back at you. Your husband isn't saying everything's a sore because he's a horrible person. It's a disease. So how do we treat people with disease? We have empathy, we have compassion. The people are not stupid. Remember, we said that it's possible that in fact a high IQ is what leads to OCD. And so it's very important to remember these people are not stupid, because you think someone's stupid. What are you, crazy? It's nice. If you know that Bedika is fine and you do it again and again and again, that's stupid behavior, then you're stupid. The answer is no, you're not stupid. You're sick. I think it's quoted as Einstein, although of course it's one of those postmodern questions about whether Einstein actually said it. But Holofen, it's quoted as Einstein said that a fool will repeat the same results, hoping they will get a different. They will repeat the same action, hoping to get a different result. So we think if you do that again and again, you're stupid. The answer is that the person is not stupid. That's not a stupidity. It is an illness. In the same way the person has cancer, we wouldn't say, oh my gosh, they're terrible people. That's terrible. How can they have the cancer? And if they smoked, I guess you say, well, they blamed it, but even that, they're not to blame. It's an illness. So therefore, OCD is an illness. And we have to change our mindset when we think about it. Not only, again, when we're talking to ourselves, counseling ourselves, but counseling the person, counseling their spouse, their family, who are suffering because of that compulsion. And therefore, explaining rationally to that person doesn't help. Explain rationally, this Bedika is good. And look, you can see, and it's good. You can see it, it's good. Yep, good. Bye. Doesn't help. You haven't solved the problem, because that person knows possibly that it's okay. They know that they're obsessive, but they can't help themselves. It's an illness like any other illness. That's very important to understand, because okay, I explained. I solved the problem. I showed you, look, this Bedika is clean. You're fine, go home. And I think, I've solved the problem. You haven't solved the problem, because that person didn't come in with a rational question and therefore got a rational answer, has now solved the problem. And so this vicious cycle, again, that we're in, is sort of, we start with obsessive thoughts, lead to anxiety, compulsive behavior, and only temporary relief. And we have to understand that is where we're at. And so we may afford some temporary relief. I may tell you at the moment you're Torah, or that there's no chatzitza, or that it's clean enough for Pesach. I may tell you, I may give you very temporary relief, but I haven't actually solved the problem. I haven't in any way solved it. There is treatment for OCD. The treatment is sort of a combination somewhere of a behavioral therapy. We'll speak about that a little bit later. Just want to give you an idea that there is a treatment. And it's ritual prevention to break the cycle of this ritual repetition. And there's also medication, SSRIs, which I'll speak about in a moment, and probably this best combined together. We are not treating people for OCD. So if you came out of this hour lecture knowing, I know what OCD is, I can treat it, then I'm going to tell you, the bottom line is you can't. Neither can I. I'm not going to give SSRIs to people. You have to be a psychiatrist to give that. I'm not going to do cognitive behavior because I don't know how to do that. But I think we need to understand there is a treatment for it. And why it's important there's a treatment is because I can say to the person, and I should say to the person, there is a treatment. And I definitely say that person's family that there is a treatment. And that person should know that there's something they can do. And what we're concerned with in the next half hour or so is religious OCD. And as we saw, and it's been significant papers written about this, and as I say, you'll see in the pamphlet for Nishmat, that they bring in quite a serious number of sources that have spoken about this non-Jewish, not only necessarily Jewish religion. We care about Jewish religion because we're all given. So the first thing, very common is Pesach. Pesach, there is, I'm sure we all know, that in the women's shir, anything beyond Tu B'Shvat, there's one word that's asur to say, there's a terrible word, the P word, don't mention Pesach. I just say the word, people are like frantic, right? So they're being frantic a little bit about Pesach is normal, that's even healthy. But to be obsessive that I can never clean for Pesach. Shabbat, getting ready for Shabbat, having to for Shabbat. Shabbat comes at a particular time, it's kashrut. Right, everything is a problem. Every single I put a spoon, I waved it above a basari, a kli. It's now they're all cold. It's now a sword. I remember when we were in the army. We were a very small number of religious soldiers in a encampment in the Golan, and we took a bottle of wine, a Kiddush wine, and put it on the Chalavi side. It's all closed. It's all cold, nothing on the Chalavi side, but it's the official Chalavi side. And the Katzin, our Mefaked, our officer, went ballistic. He went crazy. He said, how can you put that down on the Chalavi side? Because we're going to have it with a Basari meal. It's Kiddush, Friday night. So I don't know whether it was OCD in that case or he'd been caused OCD by the army, but we all understand that there's no halachic problem with that. He didn't understand that. He wasn't religious. But if there are people who aren't, they can have that obsession about it. We know that. And of course, which one we care about. Here's the OCD therapy group in which the woman says, "Oh, I just love Pesach cleaning. Me too, me too, me too." They all love Pesach cleaning. So we know that this isn't 100% true why they all love Pesach cleaning. So the idea, the fascination we think about, if we now know, we can analyze that. The Chazal already spoke about it. They already spoke about obsession. And we all know this famous Mishnah, the most beginning of Psachim. We don't concerned that the chulda, that a rat or some sort of rodent dragged chametz from one house to another house and from one place to another place. You check the house for chametz and you it's clean. But maybe the rodent came afterwards. Says the Mishnah, why? If that's the case, then we would have to be concerned from any place, from a chatzer to a chatzer, from any place. You clean this chatzer, maybe another chatzer, and from one city to another city, end of our sof. And end of our sof, the Mishnah doesn't use that comment that often, or the Chazal don't use that often. They use it in various places. In this case, it very much means don't be obsessed about it. Don't overly obsess about the idea that, yes, maybe there is chametz here. The answer, well, what does that mean? How is that possible? We're going to understand what the Mishnah wants to say here. What is the Mishnah's emphasis on saying, Ein chosheshim, ein ledavar sof. So we'll keep that in mind. And it's actually very interesting. There's a few things that the Stipler wrote. So the Stipler says, there was a kid wrote to him at Bachar Yeshiva and said, I'm having these heretical thoughts. So he said to him, that's interesting. You should learn more Torah, learn this and this and this, say this and this. And why that's powerful from the Stipler, and I heard this actually from a psychiatrist many years ago, was because the Stipler says, yes, this is a problem. No, I'll just forget it. But yeah, it's a problem, and this is what you should be doing. This is he's trying to take that direction to a more positive place. What's also fascinating in the book Toldot Rabbeinu, it says the story says Ve'im Adam Yomar, so it's a mistake. Yomar it should be. We'll change it afterwards. Shechoshesh yoter mimashkadu b'Shulchan Aruch. Person says Shulchan Aruch says this, but I'm more machmir than the Shulchan. I'm more choshesh. Domelo shehu mahader b'mitzvot u'bezirut. And it says, I'm being machmir, I'm being mahader. Ube'emet u'poretz geder shel Torah. is actually not keeping halacha. V'hu metachbulot yetzer lachbid alav ol avodah al shetiyeh alav lemasa kaved. It's actually the yetzer comes to say it's going to be more and more and more and more difficult. And the person says, crazy, I don't want to do it. That a person will become so overly obsessed, and that the Yetzer Hara has got to them, and they become overly obsessed and unable to keep they're not able to keep anything. It says everything's crazy. The Chavetz Chaim actually says a similar thing in Hakdamat to the Chavetz Chaim. He says the reason why we need to learn the Ilchot Lashon Hara because the people say everything's a sore, and he says that's Yetzer Hara. The Yetzer Hara says, well, everything's a sore, not able. I can't not speak at all, so therefore I got to speak something. So there, and the person will say, well, if everything's a sore, then it must be mutar because it can't be that everything's a sore. And he says that's the Yetzer Hara. The Yetzer Hara gets a person. So the stipler is the same thing. It's very fascinating as well. Stipler is already well before we had CBT or we had SSRIs. That the stipler has this idea that there is a limit to a person's obsession, and a person can become overly frum. That's one of the distinctions possibly between, as we said, accepted rituals and unaccepted rituals is that I say I'm too from, everybody else is not from enough, I'm too from. And if my whole community is machmir on something, then I have to be machmir. That's a halacha as well. But if I'm the only person who's machmir, then, as the Ramchal already said, then you need to check that chumrah 7 times to see whether it's really a practical chumrah or it's just being crazy. Have that same question, the same suggestion that the stipler made. I have sometimes with women who say, I'm machmir on a bedika. So I don't go to mikveh on this time because I'm machmir on a bedika. So I say to women, being machmir on a bedika, that's actually okay, is the same as being machmir on Shabbat and bringing Shabbat in on Tuesday. I celebrate Shabbat on Tuesday. I'm machmir. That's not a chumrah, that's a ta'ud. We all understand it's a ta'ud. And so the mildly, overly zealot religious Jew can understand, that's not actually a chumrah. That's actually crazy. But the OCD sufferer cannot make that distinction. They can't get their head around that. And that's what I think the Sleip is trying to point out in this case. What are alarming signs when I have a person coming to ask me? So the thing that there are certain things that we can look at. First is clear obsessive halachic questions. To come again and ask the same question again and again and again, or bring you things that are clearly not a problem. Then to make the most convoluted possible questions. But what if this happened? What if this happened? What if this happened? That's the first thing. It's just to say, there's obsessive halachic questions about the possible dikdukim and etc. The other thing that we can often see is a very long time preparing a mikveh. What is a long time? So is it over half an hour? Is that a long time? Is it over an hour lifetime? That's a very good question. We know that many women and many books for Tarta Mishpacha tell women to prepare in a mikveh for over half an hour. It comes to the point, though, that in which it is a very, very long time. That's a problem. That's needs to be treated, needs to be taken to. Another problem that we can see is clean bedika cloths. A woman gives again and again and again bedikot that are clean. That's absolutely no shaila. And so if it's a woman who's a kala, triya, just got married last week, and she's very particular, but it's the woman. I say to many women who bring clean white but cloths that are really clearly white, how long have you been married? And a woman's been married for a few years, that's a problem. That's an alarming sign. Now, that doesn't mean if I get all of these things, that person has OCD. Remember, you can only identify OCD by a medical professional. But I think this is a sign they can say, okay, here's a sheila. Here we have a problem. Here we have a question. So let's understand what we as Rabbanim do and don'ts. What should we be doing and what should we not be doing? And we'll understand, if we look at the do's and don'ts, what exactly is going on in the mind of the person with OCD. So first of all, we have to assess the problem. We just said before, a person comes and says, they're worried about this bedika. So these things that you commonly encounter, you often have this concern, and it could be the person says, no, I'm not a problem. It happens to be this time I take a medication, I have I've just started contraception, I'm just postpartum, I'm in the pregnancy. Okay, then we understand there's not an obsessive behavior necessarily. It's a particular circumstance. It could be that it isn't. And the other thing is this rational? Does it make sense to you that this is a clear? So I don't know if you have to put in those exact words, but I think we do ask a question to ascertain what the problem is. I often say to the person, do you see a problem here with the Badika? And the woman might say, yeah, okay. And I can't say there's no problem here. Or, if you look here, but there's no problem here. So do you understand, is that rational? It is we Rabbanim, because we're so nice and because we're so liberal and because we're so accepting, don't like to tell people you have a problem. It's very important that if a person has OCD and you can think that that's a problem, you can't say you have OCD because you are not a mental health professional who's ascertained that, as we just said before. However, it's very important to say to that person, you maybe have a problem. And often what happens is, if I have a woman who has serious shailot with bedikot that seem to be completely superfluous, she might even say to me, I have OCD. I've been diagnosed. It's important to the person, you may be suffering from OCD. This is a problem. I'm sure this is difficult for you. This is difficult for your wife, or this is difficult for your husband. You may be experiencing some other areas of your life. This is a problem. Why that's important? Because it's important to understand that person is normal. It's common. There's no reason to suffer. I'm sure that it's very difficult for you. And you need to go to a professional for help. You need to go to be diagnosed and need to get help. And you can get help. And that's why we start off saying there is help for this. And so it's incredibly important to identify the person and say, I think you have a problem. I think it needs to be dealt with. This is the way you can do it. And there is help. And you don't need to suffer. No one wants to suffer. And the person, whatever we think, that they're in the nudnik, every person has that nudnik in their shul that's driving them crazy with 100 questions. That person is suffering more than I'm suffering. That's what we have to think about. Yeah, they're driving me crazy, but they're suffering more than I'm suffering. And you have to tell them again and again and again, because the person, that's how they get this ritual that, tell them, you came last month, that you may have OCD, you need to go to a medical professional, and tell them again and again, until they get it. It's very important to answer clearly, concisely, patiently, but very affirmatively. Ken lo. And what is the reason that? A part of the problem with OCD that we think today, and there's been a lot of work in this recently, is that it's an inability to live with doubt. All of us live with doubt, as we said before. We have this doubt as to whether we locked the car. We have a doubt as to whether we said Kriyat Shema with the proper kavanah. We have a doubt whether this thing was a chatzitz or not a chatzitz. We have a doubt, and we can live with a doubt. We live with doubt because we live with spekot, and that's how we have spekot. It's actually a fascinating thing. You think about it, Shavuot, which we just celebrated, in which we eat chalavi. The original minhag, I don't think very few people do this today, but the original minhag was to eat chalavi and basar in the same meal. That's what the Ramah says. The reason was you have shnei lechem, so you have to have a lechem that's basari and a lechem that's chalavi. That's a crazy thing. Who in their right mind, first of all, to make a chalavi lechem is bechal l'sheila l'chatit, and who does that in the same meal makes chalavi basari? It's so complicated. I think what the Torah is telling, what the minhag is telling us is, yeah, you got a Torah, you got Matan Torah, you're able to live with complex issues. You're able to ascertain, to be able to survive and to live the challenge of having basari and chalavi in the same house. It's like kol beseder, like klum. So we can have that. A person with OCD doesn't have that. They have that inability to live with that doubt. And so I have to answer clearly, surely, patiently, concisely, but affirmatively. This. Yes, no questions. We'll see in a moment. And you have to set limits and also sort of reassurances. Two b'dikot. A woman came to me before. So she lifted me this in the mailbox. Here's the whole bag of b'dikot. This is 3 or 4 days of b'dikot, in which each time there's 4 or 5 different b'dikot. So we have to say, should I do a b'dikah again? Guy tell me, should I do a b'dikah again and again until I get it clean? No, do 2 b'dikot and bring them to me. So now I've get the limit, and I've assured, if you have a problem, bring it to me. I will decide. I will take that responsibility and I'll say yes or no. There's a story that the woman used to come out in the mikveh. I think we mentioned this before, and every single time she would have a chatzitza, there's a problem. So so Rav Eliyahu, Mordechai Eliyahu Zatzal said to her, when you come in the mikveh, take a big bite, take a big bite of the apple. So when she took a big bite of the apple, she then called up and said, I've got a chatzitza. No, it's from the apple. Oh, Baruch Hashem. So suddenly I get that reassurance that I have this fallback to, this is the reason why it's happening. Again, trying to break that cycle, that vicious cycle of obsession. And also use halacha leniency. This guy called me today. Wife is having a lot of bleeding and a lot of brown. and he did a bedika, hefsek tara, and he showed it to the Rav, and the Rav said, it's not good for hefsek tara. So I said, tell the Rav that this is your circumstance, we're not going into the details, and tell him that there are opinions that hefsek tara and bedika are the same chumrah. They don't have to be, the hefsek tara doesn't be better. Because I just think that that's just not the right answer for this person who's suffering. And the other thing is that we need to ignore the 3rd, 4th, 10th call attempt. The person call you again and again and again. David Pelkowitz tells the story that he was sitting with a Rav in New York, and they're sitting talking, and the Rav gets a phone message, call me immediately. He doesn't touch the phone. And Pelkowitz can see, he's looking at David, can see, he's seeing that the phone is, call me immediately. And then it's all caps, call me back. And he ignores it. So he says to Rav, I don't get it. This guy looks like it's a real emergency. He says, I know the guy. He calls me every day. Everything's an emergency. Everything's called batting. I need my kyoto. No tzarich. When I'm finished, you and I are having a conversation. When I finish this conversation, I'll get back to him. I'm telling you it's not an emergency. So that the ability to do that is incredibly noble. They're able to say, I just don't answer that person. Call the center. They'll learn to live with that doubt. I don't have to get back to him if I answer the question. If there was no if. If I didn't answer the question, much something else. People call you up and they call you again and again and again and again. Do you have a new question? No, I just answered the question. Okay, that's the stuff. Cool, that's it. And then just stop answering. What should we not do? That's what we should do. What should we not do? We shouldn't argue about their obsession. We shouldn't get into an argument with that person. But it is a problem. It isn't a problem. That's the answer. Good, not good. That's it. I'm not going to argue with you. Don't argue about, but it isn't a good bidikah. Is a good bidikah, but maybe this way. Don't get into that argument because you'll never win. Do not create a dependency. That the person becomes dependent on you, that I now have to answer, and I am now running that person's life. So there's a woman who used to come in Yerushalayim. She was obsessive about bidikot. She would bring me a pile of bidikot. She would never look at them, because if she looked at any one of them, she would never go to the mikveh in her life. And I would tell her, mikveh is Tuesday. That's it can become a sense that you are now running that person's life. The person's 100% dependent on you. We love that, but it's terrible for that person. Don't be like frightened or shocked from the question. Hey man, that's the problem. Really? That's a question? Don't never try to express a fright or a shock or give them a sense that this is a terrible question. Don't fear setting limits. Tu b'dikot. Take the bite from the apple. Don't have a fear of that. We're frightened. I don't want to take control of that person because maybe they have a problem. No, don't be frightened of that. Don't lose the argument and sort of be convinced. Like you say, no, but it is a problem. But I there is a question in the chudi. So maybe maybe there is a question in the bedika. Maybe it is. Don't get into that. Don't say don't enter the argument. Don't lose the argument. Say maybe the person's right. Maybe there is a question. Don't get impatient. Don't get aggressive. Don't start shouting at them, get annoyed with them with a nudnik. Don't give indecisive answers, such as I think it's okay, maybe it's all right, maybe it's not okay. Rav Shechter used to answer, maybe it's okay, I think so. So that's the way I answer because that's what I learned. But people don't like that. People want to know, and especially these people, they want to know: is it okay? Things okay? Don't say things okay. It's good. Yes. Maybe you can believe if Shalakil. If Shalakil is a wonderful for some people, it's a terrible for these people. Because if Shalakil leaves us a greater doubt, we want to break that down. We want to degrade it down. What's very, very important is that if I become that person's guru, that's wonderful for my ego. Look at this. I am saving that person. I am getting that person to go to mikveh. That's wonderful. I am, I'm the rabbinic Superman. I'm, amazing. I'm saving that person's life. And in fact, it's terrible for them. And we rabbis, l'tzarenu, have this natia that we think, A, we can solve every problem. And B, we love to tell our success stories. You come to rabbinic conferences. Oh, I have this, I have this person I saved, this person I saved, this flat. It's wonderful. It's any flat. But it doesn't work. In this case, we are not doing a service. We are doing an disservice to that person by taking control of their life. What we need to give them is an answer, and that's it. And we are not running that person's life. It's a wonderful ego trip for me that I am now saving that person and I'm deciding and I'm giving them and because of me they're going to mikveh, it's any fla. That's not the treatment for this person. And we have to understand that. The other thing we have to understand is that we don't know everything. We are not medical professionals. We are not healthcare professionals. And therefore, we cannot diagnose these people and we can't solve them. We can't give them treatment. Talk a little bit about treatment. I mentioned it before, but I didn't think. So what's the psychotherapy? Now we understand. So learn with and handle it out. That's the basic of the psychotherapy. We're not going to do it now. I have no idea how to do that. But that's the treatment. The treatment is to say, like you and I can live with a doubt, like people here who don't have OCD can live with doubt and suffix, they can live with suffix. You have to learn how to live with suffix. That's the treatment. That's how it works. And within that, and as part of that treatment, it's to learn to decrease the stress, the anxiety, the fear that irrational things are going to happen, or even that rational things are going to happen. But the fear that they're going to happen is sometimes greater than they're actually happening. Remember, Chazal spoke about that the fear of things happening is sometimes greater than the actual thing, and the abstaining from this, just getting out of this sort of reassuring ritual, of this ritual that's it's basically very, very unhealthy at the end of the day. So that's really that's how treatment works. And this cognitive behavioral therapy, which we spoke before, changes that cycle. But what does it do? Is the feelings, to look at how they create behavior create thoughts, and thoughts create feelings. So to understand that the cycle can be actually a more healthy cycle, that we can have thoughts that are much more positive, and to recognize that, and to recognize how those thoughts can lead to feeling which lead to more positive behavior, as opposed to these repetitive, unhealthy, disordered behavior. That's basically how it works. Again, we're not going to treat how to do that. That's not my spec today. There's lots and lots of books, some of them better and some of them worse, but there's tons of books now coping with CND and overcoming OCD and living with ECD, and some of them are treating how to treat them, and some of the books are treating how to live with it and how to live with the other people. It's important that maybe to give the spouse to talk about it, to say, there's literature out there, things you can do. Other treatment, which we said, is SSRIs, which is a selective serotonin reuptake inhibitor, which is to do with, it's basically an antidepressant. It also, in fact, works for premature ejaculation, by the way. And SSRIs has to be given by a psychiatrist, we said, and work in combination usually with CBT. What's the recovery rate? So about 10% have a complete recovery. That's it. They don't have OCD, and about 50% will have an improvement. So what's an improvement? So a woman told me that she prepares for the mikveh 4 hours to prepare for mikveh. I said, well, that's kind of a long time, right? She said, well, it used to be 8 hours. After many, many, many sessions of therapy, I was able to get it down to 4 hours. So that's 50%. You're going to get there. Well, I still have it. I know that I have it. I'm recognizing the fact that this is abnormal, but I can't stop it. But I'm better than, I'm 50% better than I was, or 100% better than I was before. So let's look at a couple of case studies that we saw. Some of them I translated, and some of them I left in the original language because that was what was written to us. And you'll see just a little bit about how some of the things that we just spoke about are very. You'll notice, you recognize them as we spoke. So we'll take the case of Miri. Miri's 24 years old. She's married, one child. She suffered for a few years from OCD surrounding bidikot and mikveh. That's basically what OCD. Now. We said OCD. OCD. Some people are OCD in everything. That's very rare. Most people are OCD in a particular area. That area we're OCD in kashrut. I'm not in anything else. I'm OCD in tefillah. I'm not OCD in anything else. Just in tefillah. Just in tefillah. The saying Shem Hashem. That's crazy, but everything else I'm fine. So she has b'dikot and mikveh. So for this woman, Shiva Nakim are the hardest days ever, because every color is red. Every color is similar to red. It causes anxiety. It means it's a color in the street. You see a red in a billboard. She read a red fire engine. So she's frantic. Oh, maybe it was from me. Maybe it was from there. Maybe. So she cleans herself half a day in preparation for the mikveh. Right. So the mikveh takes a day off. She has to go get prepared, and of course she's cleaning herself and washing and constant washing and b'dikot. So she causes abrasions to herself. She has this obsessive hair pulling. So she's causing bleeding from her hair. This idea, but she sees I'm being machmir. We have to break the cycle of saying this is machmir. She concludes the preparations exhausted physically and mentally. She's completely wiped out, and her husband's going crazy. She dips numerous times, and without a big sentence, who knows her, she would never be able to tovel at all, because she would just be too frantic to get in the mikveh and then to get out of the mikveh. So remember, we're talking about Miri, but Miri's got a child. Miri's got her husband. They have to live with it. They have to live with this idea that Ima's frantic around this Shivanakian business, and are frantic around going to the mikveh. and that causes incredible anxiety for all of them. She used to ask rabbis, but gave up when she saw they did not help her. Rabbis didn't help her. What will happen? It was very interesting, actually, because she got a lot of heterim, but she was unable to perform. Do less bedikot, or only prepare an hour. She wasn't able to do that because the rabbis are reformed. How can he say such a crazy, crazy thing? And a extension of this question, which we sort of alluded to before, is she considered her son is corrupted spiritually since she was not scrupulous in Tartar Mishpach. My son is going to end up being a kofer and end up being shygets because I wasn't machmer. I wasn't particular enough. And she gave every part of her body that's not clean enough and everything. And so this is the case study. So this treatment needs to go to a medical professional, because a mental health professional. This is a very common description of her problem, and it's very localized. But we can understand the ramifications of that for well beyond. If she thinks her son is spiritually corrupted, so we can imagine how she relates to that child. Let's look at another Avram, who's an Avrech. He's 21 years old. He's just got married recently. Before the wedding, was obsessed with thoughts around halachic matters, doing the right thing. So he had thought originally. First to start off with, had thoughts of a crucifix during tefillah, specifically when he saw Shem Hashem. He was unsuccessful in overcoming these thoughts. He saw sort of every time he saw Shem Hashem, he saw a cross. Under the chuppah, right? Under the chuppah is the most happy time in a person's life. Yom Chatunato, Yom Simcha Libo, says Shlomo Melech. So under the chuppah, he was plagued with his thoughts about halachic issues. The ketubah wasn't right, and maybe it was a mistake in the ketubah, and the schum of ketubah, he didn't understand it, and the kavanah for the brachot was wrong, and he doesn't know, and if he didn't hear properly, so it became, the whole thing was just fraud. He comes out of his wedding, overcome with plagued by this terrible anxiety that he's not really halachic married. That's how that marriage worked. So then it got worse when they actually married. He was obsessive about Marat and was afraid to look at her clothing, even not to look at her underwear. Her clothing, anything was a problem. Unless he saw something, maybe blood, maybe he saw on a shirt, on a skirt, on anything, on a tichel, anything. So now he doesn't want to look at her, because if I look at her, I'm going to see something red, and I know that she's not scrupulous in keeping halachas. It got worse, and even after she became pregnant, she's pregnant. There's no bleeding. She's mesureket damim. Still got worse. Still, he wasn't able to look at her. To the point that he didn't put the light on when he went to the toilet, when he went to the bathroom, out of a fear that he'll see ktamim in the trash. There'll be toilet paper, and he'll see ktamim on those pieces of toilet paper in the trash. So we can imagine, he goes to the bathroom in the dark, with all the ramifications of that, what that does to the bathroom, and what it does to him, and what she thinks about him, and her respect for him. And when the Rav discussed him with the possibility of affect him, he claimed he saw sin in color. There's blood. I say, of course, there's a suffix, but this isn't a suffix. This is a vaday. This is a dam. This is a lo shel bichlal. So he got to the point that he wasn't even when the Rav explained to him, this is a suffix. Vaday she is suffix. But then zelo suffix. This is vaday dam. Look at the case 3. The next 2 or 3 cases, I think, were things that I just took letters that people wrote to us. L'tzari ani sovelet micherdat mikvah. Fear the mikvah. Masha omer, what does it mean lamaisa? Ki achanot, hold on 1 second, just going to turn the light on here. Oh, it's a bit better. Masha omer, ki achanot likrat tefillah asuyot lekachat shaot. Takes hours to get ready. Ulachal tefillah ani tamid betucha shachachti masha. So then we say, I go prepare. Okay, let's take you 5 hours to go. Okay, say you'll invest 5 hours, but afterwards, it's okay. No, afterwards, remember we said that there's no reassurance in that action. It's a very, very limited amount of insurance. So now, afterwards, I'm also worried that I didn't do it. I didn't do it properly. Remember the Miri, that her son is corrupted because of her unscrupulousness in performing the mitzvahs. Tamid betucha shehachti mashu shaita alai chatzitza kolshi. הדבר כמובן פוגע במצב רוח שלי. הלחץ אינו תורם לזוגיות או לחוויה החיובית שאמורה להיות ביום התפילה. So that we just saw before. She recognizes here. Mary didn't recognize how it was affecting her husband. This woman affects it. So I understand. It affects my husband. It affects me. I come out. I'm exhausted. I'm and on the mood. לכן אשמח לקבל פירוט של כל מה שעליי לעשות לפני תפילה בצורה מסודרת. Give me a list of things I need to do. וכן פירוט של דברים שאינם מעכבים. Tell me things I don't need to do. אני רוצה להאמין שזה יקל על התחושות הקשות והלחץ בימי תפילה. תודה מראש ושכוח על כל פועלכם. Good questions, it's true. Would preparing for this woman a list of do's and don'ts, would that be good for her? Potentially, yes, if it was very, very limited, if it was very tamsiti, it was very concise. But to start getting into different, it'll create more of a problem. She's convinced it's good for her. We're not convinced. Another letter we received, אתמול עשיתי הפסק טהרה ומוח דחוק ויצא נקי. קמתי בבוקר, לא כיוונתי לקום לגמרי, אלא רק ללכת להתפנות. I just want to go to the bathroom. עשיתי בדיקה. Why did she do בדיקה? If she's just getting up to the bathroom, it's not clear. וראיתי שהיא תמיד בסדר, שהיא הייתה בסדר, וחזרתי לישון. Went back to sleep. במשך היום, פחדתי אולי בגלל שהייתי עייפה, לא הסתכלתי טוב על הבדיקה, ולכן הוצאתי על הבדיקה מהפח והסתכלתי עליה שוב. ולא ראיתי כלום, חוץ מהפרשה צהובה. There's nothing on the בדיקה, apart from a yellow secretion. So everything's good, right? לא. לאחר שהסתכלתי עליה, הרבה זמן ראיתי כאילו יש שם מין חוט סבדק ממש בצבע אדום. זה לא נראה חלק מהפרשה. So where do we get the OCD here? It's perfectly fine what the woman did. Because she looked at it a long time. She saw something clean, doesn't say, okay, that's good, fine. The fact that she sees it, that it's okay, doesn't reassure her that it's actually okay. In fact, it becomes worse. So now just look at it again until I find something. And it's not part of it, okay? עלה בי מחשבה שאולי זה משהו שמטמא. אבל אני בכלל לא בטוחה שהיה משהו באדום. I don't even know if it's red. אציין שבמשך תקופה לא קצרה, יש לי מחשבה אובססיבית בעניין טהרת המשפחה. The woman here has a very high understanding, very high recognition of her situation. I know that I have an obsessive thoughts about טהרת המשפחה, בדיוק בדיקות הפסק טהרה חצות במית. So here again, woman does a bedika, it's not clear why. It's good, but it's not good. Then it is good. Yeah, but maybe it's not good. But it is good, because it's not part of the but maybe it isn't good. So that ritual of the very temporary relief from my anxiety is something that we recognized before. We spoke about in OCD. Shalom Rav. בערב הפסק לאחר שהוצאתי מוח ושטפתי ידיים ראיתי על הציפורן אחד האצבעות לכלוך קטן שנראה כטמטם. Looks orangey. לא הצלחתי להסיר בעברת יד, I couldn't get rid of it. אם כי איני בטוחה שלא היה על הציפורן. I couldn't, it maybe was on the fingernail, not on the fingernail. It sounds like here a little bit of leftover fingernail polish or something. מכל מקום, אז ראיתי מתחת לציפורן שהיא קצרה, לכלוש שנראה כמו דם. Underneath the fingernail. עוד מאוחר יותר, a little bit later, למיטב זיכרוני, אך לא בטוח כבר אחרי שהייתי בטורדה בהכנת אוכל, נכנסתי לחדר שירותים ונדמה היה לי שאני רואה אדמומית על היד. העברתי נייר לבן ולא יצא לבן, הנחתי שזה אדמומית של האור, אם זה סיבה לחשוש. What did the Mishnah tell us? As I said, we'll leave the Mishnah. What did the Mishnah tell us? Ein ledavar sof. I.e., if once they get into that cycle of everything's a problem, ein bemet ledavar sof. And I said what the Mishnah said, break the cycle. Don't think that everything is problematic, because this woman, every single thing is problematic. And the concern that I didn't do it again, that's really also what we saw the slide was speaking about. I want to look at a couple of exchanges of WhatsApps that was with one of the Rabbanim in the Machon. That says the following, שלוש שאלות בבקשה. כשראיתי לבעלי את העד, והוא נגע עם האצבעות באמצע סוף השוד וטובה, לפני שבכלל הסתכל, אולי היה שם דם, maybe he touched it and he moved the דם, יכול להיות שזה נסרח או עבר, לאצבעות שלו, maybe went onto his finger, הוא כבר לא היה לעד, זה בעיה? First question. Second question, כשהוצאתי את העד מהאצבע, הוא מסתובב, it went, continue going around, ולא זכרתי מה הצד העליון, what's up and what's down, הנחתי שזה צד מסוים, לפי הצורה, אבל אני מפחדת שהנחתי אותו הפוך, maybe I did upside down, ואז בלגן. Third, אחרי שהנחתי, נגעתי עם האצבע הטובה שאליה היה העד ממש בקצה הדף, I touched a paper, אני צריכה להראות את זה לבעלי, לרב. This is the answer the Rav gives on the green. A, לא בעיה. B, כנ"ל, לא בעיה. Gimel, לא. That's it. No pilsufut, no getting in. Simple. We said that's a do. Simple answers. Yes, no. Just to give a clear answer. And that's it. She comes back. That's it. There's no answer again. This is a little bit of a longer enough. I have time to see this whole thing. It goes in, but I just want to see the end. The woman says, "As התגובה הזאת משמחת ומרגשת אותי. לא חשבתי על זה בכלל מהזווית הזאת. I didn't think about it. You'll read it inside. אפילו לקחתי את זה בהומור, כי באמת מבחוץ זה יכול להיות מצחיק. אז תודה רבה על החיזוק." What gives a chizuk? You can do it. You can get over it, etc. So I think what we learned from this understanding is that OCD is a mental disease. It needs to be treated as such. We need to have rachamim, chemla. We need to not to blame that person that thinks it's a problem, but to understand that it's not a new condition. Mishnah already speaks about it. It's not a specific condition. We speak about different areas of halacha. In this particular area, we need to have compassion. We need to understand. We need to not be shocked, but we need to give a clear answer and to give the person chizuk and to tell them, saying again that we often don't want to do that, give limitations, give an answer, and give a specific answer. I'm not going to get into it and go back and say, I already give the answer. And once I tell you give the answer, that person said, "Oh, you already received the answer. You got the answer." Sometimes in the same conversation, you go around and around and around. I say to the person, "Kibanu tshuva," and I think we answered the question. So, yesh chod shela? Lo, so. But, so, l'tot shalom. And the person has to learn also to live with that suffix, that they can't take the rav and becomes the punching board again, that I'm going to ask again, the same question. So, kibal tshuva. So, and to give that chizuk, and sometimes to say, not to become the dependence of the person, not to become the Superman that I take that, everything I can solve, but hear the person, give them an answer, exactly as the Rav wrote here. Ken, kanal, lombo, yeah, that's it. So, not to get into more. Basically, our lives as religious Jews are somewhere along this axis of a machmir tavo la bracha and ivdu ad Hashem b'simcha. Now, for many of us, that brings us simcha. The chumrah is going on no simcha, nifla. There's not a stira. The person with OCD, many times that's a stira. But the chumrah, the makom to the bracha that I want, exactly as Miri said, my child is dainty because I wasn't from enough, so I want to be machmir, is a pegam on my simcha. And when that happens, and the person has to say, there's no reason to suffer, you can be solved. There's things there that we can be treated, we can deal with it. But tzarich, there's no reason that you suffer and your family suffer, etc. Zeu, sheilot, lo, mitzuyan. Sorot tovot, I will send you the B'ezrat Hashem, the PowerPoint, and as I promised, the Choveret that came out from Nishmat just most recently about OCD and Tartar Mishpacha. I haven't read the whole thing. I can't vouch for everything halachically there, whether it's okay or not okay, but I think I'm sure that it's an interesting presentation. Shalom, shalom, Sorot tovot.